Hi, I am Dr. Rameli at Seattle Natural Health. So I have a ton of patients that come in all the time with ankle, foot, and toe pain. And I can tell you as a chiropractor, we can really help that safely and effectively to get rid of the pain. And the way that it works is on the ankle joint here, you have a bone called the talus, and then the knee bones come down here, sit on top of the talus, and they form the mortise joint. Now it's really cool, if your foot's moving properly, you can get dorsiflexion where your foot comes up like this, or plantar flexion where your foot comes down like that. But what happens if that joint gets stuck, and that's what I see in almost all the patients who come in who have this pain, is then all of a sudden that joint doesn't move very well, and that creates a whole host of problems for your foot. And then you're not going to be able to play sports, you're not going to be able to walk, your foot's going to hurt you at night, you're going to develop all these other problems like bunions, metatarsalgia, all these syndromes. Now what we can do, if we can get that joint moving properly, then you're going to have good motion in the joint and you won't hurt so much. So how do we fix it? Let me show you. Here we have an unhappy foot and ankle. So as I talked to you before, this is called dorsiflexion, and that's plantar flexion coming down. Most people have a problem with this dorsiflexion coming up like that. The joint doesn't move and it gets stuck. If it doesn't move, it transfers all that stress down into the foot here and especially in the toe, and that's where you start developing lots of pain. So after I've ruled out any fractures or a torn ligament, I can actually start treating the foot. So what I'm going to do is I'm going to grab the foot here and I'm going to very gently pull down, and I'm taking the tension out of the knee, the hip, and the ankle so I don't hurt any of the ligaments. I'm going to grab her ankle here like this. I'm going to pull, and then all of a sudden I'm going to give a quick tug here, just like that. So when I do this on patients, they absolutely love it and will feel like a sensation of blood coming back to the area. And I find that it fixes it so much. A simple adjustment like that will help your foot so much. And then what I might also do is adjust some of the foot in here, and then also adjust the toes, especially that big, the toe and that second toe get really stuck. That's that metatarsalgia that we hear about. If I can adjust that, that's going to really help also. Now another component that we have to look at is the fascia. So the fascia is like plastic or saran wrap. And what it does is it actually holds our body together, surrounds our organs, our glands, all of our muscles. But anytime there's been trauma to the fascia, it starts pulling here like this. But then what happens, it starts pulling like that, it starts twisting over in another direction. Then once that starts twisting, and then you have trauma to another area, then that starts to pull like that. And all of a sudden the fascia starts twisting and turning like this, and your whole body can get locked up in those directions. So it's really important when we're working on the foot that we actually release the fascia in the foot so we can get normal range of motion. So I'm going to use something, this is developed by an osteopath many years ago. It's called a percussor. And I'm going to show you in a minute, when I'm holding the foot, I'm releasing that fascia from there so we get proper blood flow, proper nerve flow, and the foot starts to function better. So all I'm going to do is put this right on her foot like this, and I can start to feel that fascia release off that muscle and the tendon. And patients love this, it feels really good. The next thing we use is something called a cold laser. And this laser is awesome because it emits this light that helps with inflammation, pain, and it gets the nerves and muscles talking to each other. And we call it cold because it produces no heat. So often we'll hold it over that joint that's been injured or traumatized, and that will help it to heal dramatically also. So we're doing the laser, the fascia, and adjustments, and that makes a big difference. The big question I always get is, why does my foot and ankle hurt? I would say half the people we see have absolutely no trauma or injury to their foot, and yet their foot's in lots of pain. We also see people with an acute injury, which that makes more sense. But again, a lot of these people just come in, they say, I don't even know how I developed this. So here's the answer why people have lots of foot and joint pain. Shoes. Everybody is wearing shoes way too much. The last tens of thousands of years, humans have been walking on the face of the earth barefoot, wearing leather sandals or leather boots, and we're not wearing rubbered shoes and walking on cement all the time. So the first thing I'll tell patients is go barefoot on the grass or on the sand. When they do that, they love it because all of a sudden your foot is going through a normal motion. You're actually connecting to the earth. The earth actually holds an electric charge, and that actually helps heal the body and is an anti-inflammatory effect on the body as well. So I tell anybody with foot or ankle problems, as long as they don't hurt themselves while doing it, is spend at least 10 minutes a couple times a week walking on grass or sand, and that makes a huge difference. So this is Dr. Rameli from Seattle Natural Health. Have a great day.